The Deputy Prime Minister on Thursday suggested further delaying plans to change the way the NHS in England is run. Speaking to senior representatives from health charities and patient groups, Nick Clegg said he wanted MPs to be given another chance to scrutinise the health bill once concessions are made next month. Earlier, the British Medical Association called for the bill itself to be withdrawn. Meanwhile, inspectors raised serious concerns about how elderly patients are being cared for in some NHS hospitals in England. The Care Quality Commission said 3 hospital trusts failed to meet legal standards for giving patients enough food and drink and treating them in a dignified way. The Royal College of Nursing described the findings as absolutely shocking. On the same day, a new report suggested that record numbers of people are ending up in hospital in England as a result of alcohol abuse. The figures compiled by the NHS Information Centre show that in the year to April 2010, more than 1 million people were admitted to hospital because of alcohol abuse. That's a 12% increase on the previous year. A new home for the penguins at London Zoo was unveiled on Thursday.
A BBC investigation finds vulnerable adults being abused in a residential care home. 4 people are arrested and released on bail. Shock as hundreds of thousands of asylum seekers are allowed to stay in the UK. MPs say it's an amnesty. And 100 years on after its launch, commemorations in Belfast for those who perished when the Titanic went down. Welcome to UK Reports, looking at the major British stories over the last 7 days. The week was dominated by health stories. On Tuesday, it was announced that more than 15,000 people had responded to the government's so-called listening exercise on its health service reform plans in England. The proposed changes, which would see doctors get more control over health spending, were put on hold after opposition from within the medical profession and the coalition. One of the most controversial aspects is a plan to increase the role of the private sector within the NHS, as Robert Peston reports.
The National Health Service, an institution beloved of the British people since its creation more than 60 years ago. Is it now time for fundamental change in the English part of the NHS, based on an increased role for private companies? The health service has been buying stuff from the private sector forever, such as this £650,000 scanner made by Siemens. But increasingly the government, or at least the Conservative part of the government, wants the private sector to compete directly with hospitals like this one, the Chelsea and Westminster in West London, in the belief that that'll spur hospitals to become more efficient. But for critics of the reforms, it'll undermine that crucial public service ethos of the NHS. That said, private companies competing for NHS contracts to provide assorted hospital and GP services isn't altogether new. In 2006-07, primary care trusts spent £2.6 billion on healthcare provided by private and voluntary organisations. That increased to £3.9 billion in 2008-09, a rise of 50%. Even so, that was only 5.3% of all spending by those primary care trusts. This South London GP practice and walk-in health centre looks pretty much like any other in the NHS, but it's in fact run by a private company. So in your view, what's in it for the patient from these reforms?
Patients have got a better deal, better outcomes, shorter waits, the waiting times tumbled. I remember patients waiting 18 months for a hip operation. They now wait, on average, 8 to 9 weeks. So it's the quality of services which are disproportionate. So the survey, 25,000 patients last month, showed that 7 out of the 10 top hospitals rated by patients were independent sector.
The worry for some health professionals is that private providers will cream off the easiest, most lucrative work, leaving an overworked, demoralised public sector rump.
The idea that the NHS can be sort of treated as any other market and opened up to any willing provider. We believe there's plenty of evidence to show that this doesn't drive up quality, doesn't drive down cost, and actually ends up in fragmentation of services.
This passionate debate about extending the private sector in the NHS is relevant to an even more pressing issue.
Well, the big challenge for the NHS, apart from the reforms, is actually the money. It's going to have a small real cut over the next 4 years in England. There's the worst settlement it's had since 1948. The big job is to improve productivity.
Or to put it another way, with or without the private sector, the NHS is going to have to do more for less. Robert Peston, BBC News.
Lord Taylor of Warwick became the first peer to be jailed following the Westminster expenses scandal. He was sentenced to a year in prison for making more than £11,000 worth of fraudulent claims. The former Conservative peer is now facing suspension from the House of Lords. An official inquiry was ordered after a BBC Panorama programme exposed shocking abuse of people with learning disabilities at a private hospital in Bristol. The footage, which showed physical attacks and taunting, was filmed at the Winterbourne View Hospital. The watchdog, which oversees care services, admitted it failed. 4 people were arrested. Paul Kenyon reports.
Located on an industrial estate on the fringes of Bristol, this private hospital looks after people with learning disabilities and autism. By secretly filming inside the unit, the BBC found staff out of control.
You know that I don't let you get away with it.
And patients suffering. The parents of one victim had no idea any of this was going on.
She's trusted these people in there and what are they doing to her? Uncle, Mum! I never thought she was treated like that. Not in a million years.
It's the sort of abuse that was widespread decades ago when people with learning disabilities were kept in large asylums. It was supposed to stop when they were shut down. Clinical psychologist Andrew McDonnell viewed the footage.
Where's the therapy in any of this?
Say it then.
I would argue this is torture.
13 members of staff have now been suspended and patients moved to safety. The police have launched an investigation. Castlebeck, the company that runs Winterbourne View, has issued an unreserved apology. It's also set up independent reviews of its 56 homes and hospitals and is examining all patient records for any concerns. Paul Kenyon, BBC News.
Staying with care services, but this time for the elderly. The future of the UK's biggest providers of residential homes was thrown into doubt this week. The private Southern Cross Group has been struggling to deal with falling income and posted a half-year loss of more than £300 million. The group looks after more than 30,000 elderly people. On Thursday, a group of MPs said so many asylum seekers had been allowed to remain in the UK that it amounted to an amnesty. The huge backlog of almost 500,000 cases identified 5 years ago had been drastically cut, but the Home Affairs Committee was not happy with the way it was achieved. Only 38,000 cases had been rejected. Mark Easton studied the figures. His report contains some flash photography.
If you have an amnesty, you wave a flag around the world saying, come to this country, stay illegally for long enough.
During the election, Tory immigration spokesman Damien Green accused the Liberal Democrats of proposing a dangerous amnesty for irregular migrants who'd been in Britain for more than 10 years. Now he finds himself accused of sanctioning a silent amnesty for asylum seekers who've been here for more than 6 years.
Officially declare Morton Hall Immigration Removal Centre.
Opening a new detention centre, the Immigration Minister wants to demonstrate the government's toughness. But faced with a huge backlog, Mr Green has admitted that tens of thousands of asylum seekers whose cases have never been investigated are being allowed to stay in Britain, with far fewer being removed.
There's absolutely no amnesty. 40% of them have been granted leave to remain, which has been a figure that's been consistent, actually, since about 2005.
This illustrates the government's problem. A backlog of asylum cases equivalent to the population of Liverpool has been allowed to build up since the 1990s.
When officials tried to sort through the 450,000 case files, they discovered that almost 74,500 had disappeared. 129,000 were errors, and there were 161,000 asylum seekers who'd been waiting 6 years or more for their cases to be resolved, and they have now been given leave to remain. Fighting for extradition through the courts would have been hugely costly and probably fruitless, so a more practical solution was to let them stay and put resources into protecting our borders now.
There can be a big difference between making policy announcements and implementing these policies in practice. That is because once you're in government, there are certain realities that you have to deal with.
Another example of politics colliding with practicality is David Cameron's election promise to slash net migration.
I'd like to see net migration come down to the level of the 80s and 90s, where it would be more like tens of thousands.
When the coalition came to power, net migration was put at 142,000. The latest figures show it has risen to 242,000. Now, the causes are not actually in the government's control. Emigration, people leaving Britain, is down, and immigration from other EU countries is up.
Politicians want to sound tough, but when they're faced with the complexities of immigration, they find it hard to get their rhetoric to match the reality. Mark Easton, BBC News.
The Tote. The state-owned bookmaker will be sold by the government to the Betfred chain of betting shops. The price wasn't announced, but Betfred is thought to have bid around £200 million. The deal will have to be rubber-stamped by Brussels. Attempts to privatise the Tote began around 14 years ago. An investigation started into an explosion and fire at an oil refinery in West Wales in which 4 people died. A 5th person was taken to hospital with serious burns after the blast at the Chevron site near Pembroke. Police said the explosion happened in a storage tank which was undergoing maintenance.
The aftermath of what police have called a tragic industrial accident. Maintenance work was being carried out at these tankers when an explosion forced a fireball into the sky. 4 workers have been killed. But police say the severity of the blast means it may take some time to recover and identify the victims.
A multi-agency investigation into the cause of the explosion is now underway, involving police and the Health and Safety Executive. Early indications suggest that this is a tragic industrial incident. Sadly, 4 people have lost their lives and a 5th person remains in hospital critically ill.
Last night's explosion was so big and so fierce, it shook windows for miles around. In this community, everyone knows someone who works at the refinery, and they're shocked by the fatalities.
You know, we live in harmony, you know, there's been accidents before, but nothing too serious, no fatalities to any degree, so this was quite a shock.
This is one of Western Europe's biggest oil refineries, processing 220,000 barrels a day. Production now is continuing as normal, but last night's events have clearly left their mark. Howell Griffith, BBC News, Pembroke.
The Queen visited the Isles of Scilly on Friday. It was her first time on the islands in nearly 45 years. She toured a school and inspected a new fisheries patrol boat.
Things have changed since the Queen's last visit to the Isles of Scilly. In 1967, she sailed here on board the Royal Yacht. Back then, England were the World Cup holders, and we all used shillings and pennies. But today's welcome, at least, was no different from then. As she met local children and opened a new school, it felt like all 2,000 islanders had turned up. Why is it so important for you as a community to have a visit like this?
Well, it's lovely because we're a small community and it's nice to have someone important and know that we're not forgotten.
You feel proud today?
Yes, I do. I'm proud to be a Salonian.
For the Queen, this is a bit like looking round your son's house while he's out. The Isles of Scilly are part of the Duchy of Cornwall. In other words, they're owned by Prince Charles. When she last came to the Isles of Scilly, the Queen brought a young Prince Charles with her. A horse-drawn carriage ride among their experiences of island life. She was also introduced to members of the all-important local lifeboat crew. Among them, Matt Lethbridge, who served as coxswain for decades, like his father and his grandfather before him. Today, his family saw the Queen name a new vessel in his honour. How proud are all of you today?
Oh, well, we are really, but this little boat, yes, I mean, that's a wonderful thing, really. He done so much to get that, you know, all them years, really. But it's turned out well. I'm sure he'd love to have known that, but it was here.
This is a flying visit, a day trip to just one of the islands. But for people here, it means a lot. So many people have come from the outlying islands for this visit, and so many tourists are here already that there can't be a bed free in any of the B&Bs and hotels tonight. And people here are hoping that that's a good omen and this trip's a good sign for the forthcoming summer holiday season. John Kay, BBC News on St Mary's in the Isles of Scilly.